Good afternoon and welcome to Dr. Patrick Hotovy, legislative candidate from District 24. Thank you, Dr. Hotovy, for joining us for our virtual legislative candidate meetings. My name is Gina Ragland, and joining me today are AARP lead advocacy volunteers, Susan DeCamp, Joyce Beck, and Tim Potter. We also have the privilege of having David Holmquist, AARP Nebraska state president, joining us. Emily Wick is also joining us today to assist with some of the technical details for the program. As a reminder, this meeting is being recorded and will be shared with AARP members across your district prior to the election. Dr. Hotovy, we appreciate your time, taking the time for the next 30 minutes to meet and discuss issues of importance to the 50-plus voter and their families in your district and across Nebraska. As a short background, AARP is the nation's largest nonprofit, nonpartisan organization dedicated to empowering and strengthening people 50 and older to choose how they live as they age. As people live longer, healthier lives, we know we need to think differently about what it means to age. So Dr. Hotovy, if you want to start us off by giving us a little background about yourself and your campaign, thinking about 5 minutes or less there, that would be great. And then once you've completed your opening, we'll move into the question portion. So with that, I'll give it back to you, Dr. Hotovy.
Okay, thank you. Thank you guys for being here today. I appreciate the opportunity to talk with you. Again, I'm Pat Hotovy. I am from York. I am a now retired family physician as of 10 days ago. I have been here for 30 years. I grew up initially on our family farm in Bee and went to school in Bee for elementary school, went to high school in David City at Aquinas, went to Midland for college and then UNMC for my MD degree and graduated there in 1989. Went to Lincoln after that and completed my family medicine residency. And since that time, I have been here in York. I'm married. My wife Cheryl and I have been married 34 years. We have 4 grown kids. We have 1 grandchild and 1 granddog. And it's very important you mention the granddog because if you don't, you get into trouble. So. I have, again, practiced fairly over my years, full scope family medicine. I delivered babies for about 10 years and then went on and just moved on from that because I had too many kids and only 1 wife. And so moved on to just general medicine, working the ER, things like that. And certainly for me, as I went there, as you quit doing OB, your practice ages fairly quickly. So I have been doing a lot of geriatric medicine over the last few years, probably last 10 or 15 years. And so it's something that I really enjoyed and really appreciated that. So I've been active in my community. I have had the opportunity to serve on the York Public Schools Board of Education for 12 years and been off about 7 years at this point. I'm currently on the Schools Foundation and have been on there since 2014. Was president for a number of years, and then over the last couple of years, kind of stepped out of that role. I have had the opportunity to serve on the Upwards Village Board for 25 years, and recently, again, about 2 years ago, stepped off that board. I have been active in my church, different committees. I'm also the chief cook and bottle washer for our Wednesday night kids programming and for other things. So when there's a cooking job to do, I usually get asked to do a lot of that stuff. So I appreciate that. And that's kind of a fun thing for me to be able to do. I have been active in my profession, been on the Nebraska Academy of Family Physicians Board for about 16 years. I'm currently president of that organization. I've been on the NAFP Foundation for just about as many years, and I think I was president for most of those years, except maybe for about 3 or 4. So I've been that. I've been part of SERPA ACO, which is an accountable care organization, and we basically are working towards value-based care for people in Nebraska, trying to make our healthcare more affordable or cheaper, and but increase the quality as well. And so it's something that I have a lot of passion for. So I think that's really important. So people always want to know why I'm running for legislature. And if you're a state senator, it usually comes with the question, are you crazy? And I say, no, my mother had me tested, so I'm okay. So I guess it goes back to high school. I had the opportunity to sit in when I was in high school on a legislative day, and really kind of was intrigued with the body. So I have kind of followed it over the years as being able to do Family Doctor of the Day for the legislature. Certainly I had a chance to go down there 3 or 4 times a year and continue that, and always thought if I had a chance, I'd like to maybe consider that. And that merges well with the bigger reason why I'm running is one of service. And so I really want to be a service to the constituents and the people of the 24th district. And so I get a chance to meld those two things together. So service has always been an important part of my life, whether it's serving patients or my community or my profession. So it's kind of a hardwired thing for me. So that's why I'm running. Things I'm interested in, certainly I'm really fiscally conservative, so trying to find ways to lower taxes is always important. Economic development is important. Agriculture is important. Fair funding of schools is important. So, and then probably a little dabbling in healthcare would be important as well. So that's pretty much my introduction. So I'll go move on from there.
Perfect. Thank you for sharing your bio and especially things about your family and obviously your service. And thank you for all you've done for the gerontology field in family practice, obviously for 50+ population. We greatly appreciate that. Dr. Hotovy, we provided you with a set of 3 issues containing 4 questions pertaining to the 50+ in Nebraska. We're looking to, again, allot 5 minutes for each of the questions. So the first question we have for you is on health, caregiving, and home and community-based services. And Susan DeCamp is going to take that. So go ahead, Susan.
Hi, Dr. Hotovy. Nice to meet you.
Nice to meet you.
I would also like to thank you for all of your community service, your professional service, and for wanting to continue to serve the people of Nebraska by running for legislature. So home and community-based services, also known as HCBS, provides an array of services that are designed to assist individuals with daily activities that promotes independence to support them to age in place and delay institutional care. A family caregiver is any family member, friend, or acquaintance who cares for another person that is unable to live independently and oftentimes provides that care without pay. Telehealth services can be significant for older adults, especially in rural areas or underserved communities, while also providing support to family caregivers by reducing travel, wait times, and costs associated with in-person care. So we have a couple of questions for you. The first one is, what will you do to support the 240,000 unpaid family caregivers in Nebraska? Through policies such as enhanced respite services, access to telehealth, caregiver education and training, and help with out-of-pocket expenses. And our second question, what will you do to protect and or expand the home and community-based services program, particularly in the area of recruitment and retention of a sufficient workforce and adequate funding of the services that Nebraskans and their family rely on?
So let me start. I guess certainly for me and part of my daily work has been trying to help people stay in their homes as long as they can and as long as they want to. And so that's been important, and it's something that we've really strived for as we went along in medical practice. And it's difficult because again, families are responsible for care of people, of their loved ones. Sometimes they're not even in the same town or maybe even in the same state. And so there's lots of issues that go along with that. And so we've worked hard to try to find services for people that have needs to be able to stay in their home. And it's difficult because there's not always a lot of providers. And unfortunately, reimbursement for those services is extremely poor. And so we just need to try to see if we can find some more innovative ways to kind of help families in those. Certainly, there's a kind of a move towards palliative care, which I think is a good move to try to add another layer for supporting people in their homes, people with chronic illnesses. And so those things are important. Home health has always been very beneficial. Again, a little bit on telemedicine. Again, that's been a good. I've enjoyed using telemedicine, and it's a good thing. And again, it helps people not have to travel. I think you could use it as a tool to check in on people. So as part of our value-based care program, say somebody goes to the hospital or you see somebody in clinic and you're kind of concerned about them. We have a team of care coordinators, and what they do is they go out, they call people, talk to people, and continue to follow up on them, make sure they're doing okay, and then alert the provider if they're having any issues that they need to be addressed. And so we do that outside of just our regular appointments. And so having a video ability for those sorts of things would be really good. I think we could do some things to maybe prevent hospitalizations and capture problems earlier on before people actually have to go to the hospital. And I think that would be really important. And I think studies show that if people can be treated outside the hospital, they prefer that. And so I've looked at concepts like home hospitalization, things like that, and using remote monitoring and telehealth to be able to do that, maybe with some other in-person visits as best we can and frequent follow-up to try to help people achieve some of those goals. And so it's difficult because there's not a lot of reimbursement for it. And some of that stuff really costs to be able to do that. So again, I think those are things that we can add for families. Again, whether some sort of a family leave program is something that would need to be accomplished, that might be something that could be looked at as well. But certainly the state's going to have to take a look at what they're doing because they don't understand that concept. They want people to age in home. They really do, because when you look at your Medicaid budget, a lot of money goes to the care of our elderly in nursing homes. And so they really see that as a strategy to move forward, but they just can't figure out how to get there. And so certainly I think with my background in medicine and taking care of people of age 50 and over, I think I could certainly provide some light and really help out in that process. So I think that's kind of an important thing that we need to work towards. And as far as workforce, that's everybody's issue. No matter who you talk to, workforce is key. And so whether it's incentivizing people to go into a field, so whether it's help with education, loan forgiveness, tax credits, we may have to look at something in those areas where the demand is so high. And so I think certainly if we can increase reimbursements and maybe we can increase salaries, then that would help as well. So I think those are things we have to look at, and then maybe start recruiting people earlier. And so maybe we don't wait till people get to college, or maybe we start recruiting in high school and having internships and things like that, where we can bring people into a field, maybe even starting as early as middle school. I know we've looked at the possibility of maybe doing that in medicine for our academy, starting to talk with kids in middle school, because that's when they start to formulate their ideas on what they want to do. And so I think those are the strategies I think that we could employ to make that work.
Great, thank you for your answer.
Thank you, Dr. Hotovy. I appreciate your intergenerational thoughts, because we do have a lot of those too. So we would love to have more conversations about that. Our second question now will come from Joyce Beck on nursing facility quality. And Joyce, go ahead if you want to take the call.
Thank you, Dr. Hotovy, for your time. I also have a similar background. I was in healthcare for 50 years. I was a nurse for 22, and then a nursing home and a hospital CEO for 28. So my question is about nursing facility quality. Over 20,000 Nebraskans require care in nursing homes or assisted living communities. Facilities have closed their doors, citing reimbursement challenges and staffing shortages. Nebraska will need an additional 4,700 more nursing assistants, LPNs, and RNs by 2028 to meet Nebraska's care needs. Everyone, regardless of where they reside, deserves to be treated with dignity and respect, and to have access to quality medical care. Better staff to resident ratios improve the overall quality of care and the well-being of residents. Workforce recruitment, retention, and job satisfaction challenges are prevalent across the long-term services and support industry. Causes of workforce challenges must be identified and implemented to respond to the growing need of high-quality care. So my question for you, Dr. Hotovy, will be this. What would you do to improve the quality of nursing facility care for Nebraska residents, including addressing the long-term care workforce crisis in the state, professional education and training, and accountable facility reimbursement?
Well, I think certainly probably where a lot of this goes to reimbursement. And so, our staffing ratios are somewhat dictated by the money that we get. And certainly we know that Medicaid reimbursement is not good. And unfortunately, as people age, most of my patients didn't think they were going to live to 90 or 95 and end up in a nursing home. And so it creates a problem because, again, people worked hard and they tried to save for their retirements and to meet their needs, and they just can't because we've been able to keep them alive longer. And so I think we need to look at that a little bit. I think we need to find some way to make reimbursements much more fair, and so that we can provide the care to residents that we really need to, because they really deserve that. And you can see that, I've staffed 2, maybe 3 nursing homes at times over the years. And so you get in there and you get to see how the nurses work, and you can see facilities that have a little higher ratio, spend a little more time with patients, and they do much better. And I think we saw that a lot during COVID, when families couldn't come in and visit. It was really up to the staff of nursing homes to be their support. And they tried really hard. The staff they gave their lives, and just to the point where they, terrible burnout and everything, having to work with people and watch them and watch people die of loneliness in nursing homes because they couldn't see their family and their loved ones. And that was horrid. And, even for me, I couldn't go to the nursing home. I had to do telemedicine nursing home visits. And that was brutal for me because it's like, I enjoy my time being face-to-face and sitting down and chatting with something more than just about what their current health is with patients in their rooms. And so those interactions were very important. So I think certainly trying to increase staff ratios comes back to reimbursement. And so those are things that we have to look at. Trying to be a little more out of the box. Maybe we need within our communities to try to foster volunteer programs. If most people will have a church home, maybe churches need to have volunteers that are willing to go in and spend time with residents in nursing homes, the people that they know. It's like, I would certainly enjoy doing something like that. And so I think certainly you could find volunteers within communities to maybe help out with some of that stuff. It doesn't have to be a trained person. They just want somebody to sit with them. And you see this a lot with hospice. And so somebody goes on hospice in the nursing home and they get more attention, and people come in and they have a hospice worker comes in and sits and visits with them. You see their health improve considerably. And so I think if we could work some sort of a system like that, I think that would really help to improve the quality of the care in nursing homes, just without maybe even having to spend any money potentially. So, and then back to the whole staffing issue, certainly the same would be as for that as that's for home care. You have to cultivate your workforce. You have to try to support them with the education. You need to pay them appropriately, and all that goes back to reimbursement. And so again, recruiting earlier, trying to get people interested at an earlier age, I think certainly makes a difference.
Well, thank you so much for your answer. I appreciate it.
Thank you, Dr. Hotovy. Our final question for discussion today centers around livable communities and helping people stay in their home, which has kind of been the theme you've kind of gathered from our whole conversation and discussion. Dave Holdenquist is going to take that. So go ahead, Dave.
Good afternoon, Dr. Hotovy. Thank you so much for being with us. A livable community is safe and secure, offers affordable housing and transportation options that allow individuals to travel by multiple means, and provides supportive community features and services for people of all ages, which allow people to remain in their communities as they age. Affordable and reliable healthcare and transit options are critical to support older Nebraskans aging in place. And high-speed internet should be affordable, reliable, and accessible for all Nebraskans. Digital skills development is also essential to obtaining the benefits of high-speed internet access in the home. What will you do to ensure all Nebraskans, mainly those 50 plus, have access to livable communities which offer affordable housing, diverse transportation options, adequate health care, and affordable, reliable, and accessible high-speed internet including digital skills development?
So I think on the issue of affordable housing, that's an issue for everybody in our state. And certainly as I talk to people, especially the over age 50 group, that really is a big deal for them. And again, trying to find affordable housing when you're trying to downsize is really difficult. And so there are communities in some towns, but those are usually few and far between. They're also very quickly filled once they're available within the community. So in York, a lot of our arrangements that way are pretty quickly taken care of, and so they're full. So it is difficult to try to find housing, and we do struggle with that with people that really need to find a better community independently. And so again, it's something that we continue to try to work on, and I'm hoping that with some of the AARP dollars that the state has, we can work on affordable housing. I know in some places, I know in Seward County, they're really working on a couple projects to provide some affordable housing, either for workforce or for the elderly. And so I think those things are kind of important to try to support. As far as transportation, that is a huge issue that we would deal with every day. And in York, we do have some public transportation, but it's very quickly, their capacity is very quickly used up. And so we have problems getting people into the clinic for their visits. We have problems getting patients that show up in the emergency room by maybe ambulance that have the ability to go home after we make sure they're okay, and then we can't find transportation for them, or trying to get somebody home from the hospital. Family can't come. And so trying to find transportation has been very difficult. So if you can schedule it out a few days, it works out. But if you can't, it's very difficult. And so we've been kind of monitoring social determinants in our clinic and working with our health department. And so we have quickly realized it's not just people as the age that have those services, a lot of other people do as well. And so we've put together a task force within our community. We've looked at transportation issues and found out the scope of the problem. And then we've worked with our local county transportation group, and we're working with our county commissioners and trying to find ways to increase support and the amount of public transportation we offer to people in our community. And so that's going to be a work in progress, but I think we need to look at doing those things on a statewide level, whether it's providing grants to communities that want to try to do something like that don't have that in place, or just making sure that we can try to do that as much as we can. I think it's hopefully something we can do to try to help improve transportation services in communities, because I'm pretty sure that if we have problems here, that it's pretty much everywhere has problems as well. So we don't have cabs, we don't have Uber, and all those things that you can in a larger city. That kind of helps with that. And then on the matter of broadband, again, it's an issue that goes across the generations. Broadband is extremely important. I know people, I've talked to people on the campaign trail that work in Chicago or work in North Carolina, but they live in Garland or they live in Henderson and they live in small towns. And so the broadband access allows them to be able to do that. So it becomes extremely important, not just for that group, but for people as they age as well. And so if we want to use some of those services, the telehealth services, the remote monitoring services, things that we had talked about previously, you need to have good internet to do that. And so it becomes a priority across the spectrum for everybody to have that good internet. And how that looks going forward, I know public institutions that have shown an interest, there's private groups that are interested, but they just haven't been able to do that. There may be a problem that's bigger than both. And I know there's at least one partnership between a public utility, power utility, and a private internet provider to try to help improve that access. And so maybe those sorts of partnerships moving forward will be something that will be what it takes to be able to make that expansion possible. And then as far as the training, certainly, their community colleges provide some of that training. You can take classes, but if you have a local center, but if you don't, it becomes harder. And so I think certainly we have the perfect opportunity maybe for our public schools or local schools to provide some of that training. And I know we had looked at it in York at one time, trying to provide just some local classes where people could come in and do that. Maybe it could be done through senior centers. And certainly we have the best people to train on technology, which are our young people. And so that offers them a chance to serve. And so, groups that have service requirements, things like that, can maybe provide that sort of service, or people that are interested in doing that within a community, younger people, or I'm not sure I'm good enough at technology to provide that sort of service, but certainly I think there are people out there that we could use and rely on for that type of thing. And I think that'd be a reasonable approach to look at with that.
Thank you very much.
Great. Thank you, Dr. Hotovy. We're now coming to the end of our 30 minutes, which time always goes so fast. But in the final couple minutes that we do have left, I would like to offer you the opportunity to make any closing comments, thoughts, or anything that you'd like members and constituents of your district to know. So with that, I'll give you back a couple minutes if you have any closing comments.
Okay. Well, I guess, again, for me, it goes back to why I'm running. And again, the attitude of service. And again, that's really important. Things that drive me crazy is when you talk to people and say, well, we never hear from our state senator. I sent him a letter and never got a reply. He doesn't come visit us. He doesn't seem to really care about us. And I've heard that different times over the years. And so I think that's atrocious. And so I would really want to ramp up the service aspect of the job. And I think it's important that it be a year-round job, and that I meet with constituents, nearly every day if I can, whether you're in session or out of session. And so I would really want to make myself extremely available to the constituents of the district, whether it's in personal meetings, meeting with groups, meeting at senior centers, meeting for county board meetings, city council meetings, whatever it takes. If people want me there, I'll be more than happy to show up and work with them on a regular basis. And I think the other thing that's really important is that we work on issues as they come up. And certainly there's a lot of bills that are introduced every year. I think if we could get people to sit down and talk about issues, we could hammer out issues in between sessions that really would basically require us not to have legislation in the end. So again, I think that's something that I'd really like to work on. So those are issues that are important to me. Just as I provided really good service to my patients, I would want to provide that same service to my constituents if I'm elected.
Perfect. Thank you, Dr. Hotovy. Congratulations on your retirement.
Thanks.
Thank you again for taking the time to visit with us. We wish you the best with your campaign. And again, thank you so much for meeting with AARP today. Take care.
You too. Thank you very much.
Thank you.
Bye, everybody.
Thank you.
Thank you.